Within a certain department, we were having issues with customer service and quality of care. We suspected that this was also leading towards malpractice claims. In speaking with Pam Willis, our risk manager with the doctor's company, we learned about the Claims Analysis Insight Service. Both Pam and I felt that if we could find a correlation between the root cause of past claims and recurrent issues, we could find opportunities to improve our ability to give better care and better service, and ultimately reduce claims. Another benefit of the Claims Analysis Insight service was that it was included in our coverage. And that was the real kicker, and that's what sold us on this service.
Scripps is always looking for ways to improve the patient experience. I really welcomed the opportunity to work with them to identify what was driving the malpractice claims that they did have. I think that the ability to be introspective and learn from past claims really shows the incredible maturity of an organization. The first step was to obtain data from our coding analysts at the doctor's company on all of Scripps' closed malpractice claims over the past 5 years. This showed where issues were concentrated, what trends were apparent, if any. It showed what percentage of claims were caused by such things as a patient maybe not understanding their informed consent, or inadequate documentation of some care that was given, or an area where communication could be improved. We then compared the claims trends to office practices nationwide as a benchmark. We presented the data to Tony and his medical legal staff and worked with them to develop recommendations on where to focus our risk management efforts. We also presented that data and recommendations to the leadership of Scripps Clinic, who, again, were very introspective and willing to learn from any past patient issues that they had experienced.
We were able to identify 2 factors contributing to our claims in this one particular department: what patients perceived as a lack of proper informed consent, and also some areas of poor communication. We then looked closely at who was providing the informed consent, how informed consent was being presented, and how employees in this department were answering their phones and communicating information to patients. Pam prepared a follow-up report that we shared with the staff in an educational session, and that became our best practice. We now have a better informed consent process, better communication between support staff and physicians, and improved communication between the patient, the support staff, and the physician. At first, employees would say, "But this is the way we've always done it. Why do we need to change?" Well, the answer that we provided is, this is the recommendation of our insurer, the doctor's company, and they are looking out for our best interest in avoiding risk. Believe it or not, the reinforcement from the doctor's company got the employees' buy-in, and that actually made it work.